instead of using the, yeah, it's better. I'm more comfortable, yeah.
¿No funciona el teclado? No. Ah, que no funciona el teclado. Ajá, vale. No.
It's okay. It's okay. Gracias.
Aquí. Tampoco.
Yeah. Yeah. In 2015, we started a campaign for social security in one of the state of Orissa and with international, yeah, with ILO, and this is one of the picture of that. So what we do is, I, as we work on both the strategy, top to bottom, and again, this is one of the example. We work from top to bottom. And these are the women attending that workshop to create awareness. This workshop was to create awareness on social security because they too need to know what are the schemes for them so that they can demand. Because many a times it happens in formal economy, and especially women, they do not know what their rights are, so they do not go for demand. So creating awareness for demand is also part of the work which we do. This is again a women leader talking about the social security, explaining the scheme briefly. And in many of our programs, we do lots of awareness programs. So this is a vehicle which we use, which moves throughout the state, talking about the same issue of social security. If it is social security, it will move around the city for 15 days, 20 days, it's a campaign vehicle. So whole month it moved in that city, making people aware about social security things going in that particular state. Again, this is media coverage. So here I'll halt, because when we talk about women workers, the need of women workers are different. So there could be social security issue, there could be microfinance issue, and there could be those who are self-employed, could be issues related to their works. So this is one of the programs which we call Angana. Angana is basically, it means courtyard. The women working in courtyards, this is a program started for women artisans because their problem is different, could be different from other informal workers. Besides social security, besides access to finance, they also need access to market, because what the goods they make, that has to get a market. So we started this cooperative, and we started it as a cooperative and later converted it to a private company. So it is now a private company, sustainable, making money and employing people. So you can see in this program, because when we talk about even artisans, so just organizing and creating a platform and registering a cooperative doesn't work. Then they also need a proper skill to access the market. The skill has to be perfect. So in this, we also work on their skilling. Many kind of skillings goes on. We work on the latest designs, and those artisans are trained on those latest designs, and we have outlet to sell their products, because that is the major issue which happens with these informal workers, especially in India, with these artisans. They make goods and the broker earns the money. Actually, what happens? They are most of them are based on piece wise. So they make one scarf or say stall, they embroider it, and the broker gives them 10 rupees or 20 rupees, say like that, and that goes to the market in 1,000 rupees. So there is a gap of more than 900, more than 100, more than 1,000% gap is there in this, what they are paid and what goes in the market. So mitigate this gap. So we started an outlet to market their products. So we train these artisans and also provide a proper market to them. So these are the numbers. So now 350 artisans are organized in 125 villages of Bihar. So we have started this in Bihar. And again, a very major issue is issue of a child. If a child of a woman is not safe, is not healthy, the work hampers. So again, we saw this program not only as a health issue, not just as a nutrition issue, but also we connect it to the livelihood issue. Because when we talk about the women and the sustainability and solidarity economy, we have to think all the components that integrates a woman. Because if her child is not healthy, not getting a nutritious food, her working quality will hamper. And this, we took this issue again based on that. So this was a pilot program. This is a nutrition rehabilitation program where we keep malnourished children for 21 hours with the mother, so that we give them care, and we make them, the mother, we make them learn how to give nutritious food and how to fight back this issue of nutrition. And mothers are paid. Actually, this was a government program which we piloted, and now it was very successful. And now government is replicating in with other agencies across state. So there are many methods actually. These are the few examples which I am showing or citing just to make you understand and make we all understand that when we talk about inclusive economy, when we talk about gender, we have to think all the aspects. There are many things which makes a vicious cycle of economy. So we have to break that vicious cycle and to make it a virtuous cycle, we need to touch all these components. Even if you start working on the sustainable economy and we don't take care of these issues, I think this cycle again remains. So that break that vicious cycle, we have to think all these things, and Nidan, we realize it because our approach has been development as well as struggle. So whatever come as a need from the community, we took it and made it a project and the program. And as Arvind said, in few years it becomes sustainable or it is replicated by the government. So our model has been very clear that we start something, making it as a model, we create pressure on government to take it and to replicate in other part of the country. So this is how this program has become very successful, and many women who, because they were paid back stipend, those who came with the children paid wage for, because all of them were mostly they were working women, so they were paid stipend for attending those 21 days at the center. This program has also has emerged as a very successful program. I'm sorry, I couldn't translate it because I really don't know that Hindi translation. It was in this was in Hindi, so I didn't know how to do it in English, but I'll explain it. This is a program we started with government, and this program again is, it looks like a nutrition program, but it's a livelihood program. So this program is, we are working with ICDS. In one of the presentation, Arvind said that we work with Anganwadis. Those are, ICDS is Integrated Childhood Program. This is a program which works with children below 6 years and with the women. And this is an integrated program which gives nutrition, primary education and health care of these children and to the women. And we integrated this nutrition program with them. So now this community women are making this fortified food. This is take-home ration. Because in India, again, as I say, it's great that the nutrition is a big issue. If we see the matrix, So we are very low to the standard. So the nutrition is taking, so we all are working hard on nutrition, because mortality rate is very high in India. Still it is very high when we compare to the global standards mortality rate, and especially the infant mortality rate is very high, just because women during pregnancy do not take care of their nutrition. So through this program, we are giving livelihood to the community, because this fortified food is made by the women of the community. These units are set up in the village where the women are part of it. They are the owner of it, and it's a cooperative working together. So, and the profit which is coming by selling those products is again going to that cooperative. And this food we are giving to the children through this ICDS program, which is again a government program. So it's like triple, it's a PPP, it's a Nidan and government working together on livelihood and nutrition. And again, it's about the same thing. And this is again a network. As we said, we worked, because upskilling is in a very first presentation, Arvind said that it is it was not easy for us to reach millions. We can work through 100,000, but that was are not the goal of just limiting our work, limiting our goal and vision to just few thousand. We wanted government to replicate our things. We wanted policymakers to hear us, and for that we need a network of people. So this is again for this Bihar forces, which means it was started in Bihar, a state where we started our work, and Forces is Forum for Creche and Childcare Services. This is a very important forum which works with organizations and trade unions working with children and women, because in India, again, I said, a child care is a very it's not talked about issue, because politicians don't feel like working on those issues, because what we believe, they are not the voters, because many of the issues taken by the government is the issues which are political, which they see that can be politicalized and benefited. So this child issues is not taken, and that's really hampering the women workers. If there is no creche in informal, for the informal workers, because we see many children dying every day because the construction workers who work, they carry their children with them at the site, or they leave the child with the younger siblings. So it's again disturbing the cycle. The older one is not going to the school. They are involved in taking care of their younger siblings. So again, this is disturbing. So we created this forum for advocacy, and fortunately, after this was in 2002 when we created this forum, in 15 years, government has taken many of the issues which we started. Because when we started in 2002, this mortality and death and death registration was not talked about things, and all the data which we had in government was a fake data, because there was no structure and there was no system of registering in the infant death. So when we started talking about because unless and until you have the right matrix, you don't make the policies. For making policy, you need the right data and matrix. So the government was like making their own policies, deciding how many infant mortalities. So they were not going to the right data. So we started talking about the registering, the birth and death, that was taken. And then again, immunization was a great issue there, because now it has become a universal immunization. Without immunization, many deaths